Hi, I'm Dr. Amir Hannan, a full-time general practitioner at Hawthorne Thornley Medical Centres in Hyde, and I've enabled over 66% of our patients to have full electronic health records for over 14 years now. We're now beginning to realise that it's really important, in order to improve the outcomes for patients, that the information that exists in the GP electronic health record needs to be made available where care is delivered. And over the last 10-15 years there's been a big drive to try and work out how we can share that electronic health record in other places where you might present as a patient. That might be in casualty, in a community-based service, or elsewhere. It's been very challenging, and we're aware of a number of different areas where patients' records can now be accessed in other places. Usually it's a stripped down summary version of the record, although in some areas, some places are now enabling the full sharing of the record in other settings, such as for instance in extended access clinics, where we might be delivering a GP service but in a community setting elsewhere. However, in order to do that, it's important that your information is secured and that your privacy and confidentiality is maintained. And one of the security features that we have, or safety features that we have in the system, is that people can't just access your electronic health record anytime they wish. They have to get permission from you before they can access this. So typically, when you turn up at an out-of-hours service or an A&E department, the clinician may well ask for permission from you to be able to access your medical records. The problem with that, of course, is that how can the patient give permission for something that they haven't seen themselves? And what happens if there's errors in those records or things that are missing that the patient knows nothing about? And that's why I came up with this idea of responsible sharing, where the patient is first of all given full access to their medical records through an explicit consent process, which includes a questionnaire, and the patient is given every opportunity to be able to read their medical records and have a better understanding of their healthcare needs. And they can now do this through a smartphone, through a tablet, or going online. And then, having done that, when they then present to an A&E department, to an out-of-hours setting, anywhere in the world, and they're asked, can they look at their medical records? If there's a data sharing agreement, then the patient could be asked, could answer yes, and then they can go ahead and look at the record, and the patient would know what information is being shared because they've already seen it. That's if you've got a local data sharing agreement with a local hospital. But if you're on holiday, or if you're in another part of the country where there is no data sharing agreement in place, well then, as a patient, you could choose to log into your medical record and then share that information with the clinician in front of you. And this is what we call responsible sharing. Of course, we could go beyond just the A&E department or the out-of-hours accessing that medical record, but we could enable other services to be able to access that record because you've given them permission to do so. Or if we go further than that and start thinking about artificial intelligence, then patients might even give permission for their record to be shared such that artificial intelligence could be applied so that we can identify patterns within that data. But the important thing about this is that it starts with the patient being able to see the record that's then being shared by other people. We call this responsible sharing, and I believe this is the safe way of enabling patient access to records and enabling other people to access those same records at the same time. I appreciate at the moment this is not what's available throughout the country, but I'd like to think that we can work together to try and enable that to happen so that that becomes the norm for everybody.